A male patient in their mid-40s with BMI of 30 who came in asking for Ozempic, and I said no. A pill mill, a telehealth prescription app would have just given the patient GLP-1. But then we found out about another issue that was very concerning to me, which is extreme fatigue. The patient felt tired the minute they woke up from sleep, and they could take a nap anytime during the day. So telling an exhausted patient to go exercise would have been the recipe for failure. And that would exacerbate the muscle loss associated with general weight loss. And we have to solve the energy crisis first. I'm Dr. Safa Shiari, board-certified physician in internal medicine and obesity medicine, and the founder of Present Future Health. And today we'll talk about why weight management is not one size fits all, and why it is very important to see a specialist to figure out what is the underlying cause. So for this male patient, their mid-40s with extreme fatigue, we did a comprehensive physical exam and taken history, and we ordered labs. I was looking to exclude depression, thyroid disease, heart disease, metabolic disease, and we ordered tests for vitamin D, iron, B12, kidney and liver function, and we also ordered a sleep study. I had a concern for narcolepsy and sleep disorders. And I know a lot of people will think, oh, what about testosterone? And yes, it could be a reason for fatigue. However, multiple conditions of what I just mentioned could cause and result into lower testosterone level. So treating them will fix the testosterone level. So in this situation, I'd rather look into everything else. And if they're normal, there's no fixable thing, then I go test the testosterone. So a Medispa, a pill mill, a telehealth prescription app would have just given the patient GLP-1. They came into you, they're overweight. They said, we want a weight loss medication. And unfortunately, and a lot of times, they would just receive that prescription. I'm all pro GLP-1s when they're used for the right patient. Their patient met the criteria, their insurance would have covered it, we wouldn't have an issue. However, I did not want to start a GLP-1 medication on a patient that I know they wouldn't be able to exercise, and I'm risking losing more muscle than usual. And if they had a dietary deficiency, then I might be augmenting it by reducing their dietary intake. So we need to figure out what's going on. So the sleep study took about a few months to get scheduled. And in the meantime, I opted to try phentermine. It is a weight loss medication. It has a lot of restriction about prescribing it since it is controlled, and a lot of states have different rules about it. But for this patient, I felt that it would be both something that can help a little bit with appetite, and I wanted to see if it can help with energy level because it has a mild stimulant effect, and it would have steered me towards the narcolepsy. The patient, after 2-3 days, they were so happy. They got their medication, they took it, and they felt like for the first time they have energy to go about their day without any extreme effort to get their regular basic tasks accomplished. I usually start with the lowest dose to minimize side effects. Phentermine can cause palpitations, so fast heart rate. For a few patients, it can even cause elevated blood pressure. There's been a lot of studies that says in general it's safe. However, we do still need an EKG at the baseline. And then being controlled, you need to keep a close eye on that. And after a few weeks, the patient was so happy that their appetite is better, they were able to exercise. However, they felt the effect was weaning off. And then we got the sleep study result. And most of the labs came back pretty unremarkable. So we went for the sleep study. And that was very interesting because it was abnormal, but it also was not diagnostic of the common things. So it did not have a sleep apnea, central sleep apnea, or met the criteria for narcolepsy. It does qualify for hypersomnia, so the patient was falling asleep much faster than other people would. But the discussion with the sleep medicine doctor brought up an interesting thing, which is poor flow of air in the nasal passages. And then the patient tried those nasal strips, and that was great for them. They actually slept very well. And that was mind opening because the patient wasn't aware that they had poor airflow in their nose. And that was also limiting their exercise capacity because they can't breathe fast. And we ended up sending the patient to ear, nose, and throat doctors. They did an evaluation, and the patient did undergo a surgery. And they already experienced a lot of improvement in their exercise capacity. On the phentermine alone, they did lose 15 to 20 pounds. And our goal is to wean off the phentermine and see now the patient is able to sleep, exercise, adhere to a diet, not feeling tired all the time, to see what are they going to do, if they're going to regain the weight or is it going to stay off. And in this case, if the weight comes back despite regular exercise and diet, now I can go back and try GLP-1 if we need it, just because now I know the patient can maintain their muscle mass. And this is an example of how generic telehealth can be different from internal medicine practice. And if you're too exhausted to lose weight, we need to find out the underlying cause before prescribing medication just to suppress your appetite. So you can visit Present Future Health to book an evaluation and build a strategy that suits your biology. And if you're not in a state we're licensed in, follow along. I'll be sharing my perspective about cases I see as both an internal medicine and obesity medicine specialist. Thank you.